will go on display in the town later this week. The Department of Infrastructure's proposals cover Michael Street and Athol Place, with the DOI saying they're designed to make the area better for pedestrians and encourage people to spend more time in the town centre. You can view them at Peel Town Hall on Thursday between 10 a.m. and 6 p.m. The House of Keys and Legislative Council will return to their own chambers tomorrow in legislative buildings. The island's parliament, including each of the branches, has been conducted virtually since April, with members using online audio software. The public galleries for these sittings will be open and accessible via the Bucks Road entrance. International news next.
The makers of Stressless start with cutting-edge back and lumbar support, which evolves into the design of exquisite chairs and suites for home and office. Experience the ultimate in comfort and design in our exclusive Stressless studio at Millie Chaps of Ramsey.
Further afield, the UK Home Secretary says it's important that lessons are learned from the Reading terror attack. Priti Patel will update MPs with a statement in Parliament later. 3 people were killed on Saturday and 2 others are in hospital. The reproduction rate of the coronavirus in Germany has increased again from 1.79 on Saturday to 2.88 yesterday. Outbreaks have been reported in several locations. And new saliva tests for coronavirus are going to be trialled in Southampton this week. Participants will get results within 48 hours. Manx Radio News at 3 minutes past 12, our next at 1 o'clock. In the meantime, keep up to date by following Manx Radio on social media or going to manxradio.com.
ShopRite stores across the island are now open even later, 8 a.m. till 10 p.m. Monday to Saturday and 9 till 6 on Sundays to allow customers to shop at a time convenient to them.
Manx Radio weather with Manx Glass and Glazing.
Goramaya, thank you, Sean. Well, this is summer. Take a look outside from the Ronaldsway Met Office. They indicate some strong winds, possibly gales, in the North Irish Sea for the next 24 hours. On the island, wet, misty and windy, strong south-southwesterly, touching gale force later. Top temperature 16 degrees today. It will be cloudy, misty and wet after dark, with the south-southwest wind easing during the night. The overnight minimum 12 Celsius. Jamert, misty and wet to kick off with. It will be drier on Tuesday afternoon with bright intervals. A strong south to southwest wind will lessen throughout the day, up to 18 degrees tomorrow. Dry and cloudy overnight, down to 13 overnight into Wednesday. And Ukraine, well, dry and cloudy to start with, but then sunny intervals and light breezes. 21 degrees on Wednesday. High waters at 1:05 this afternoon. Low water tonight, 19 minutes past 7. Sunsets at 5 to 10. High water, 11 minutes past 1 a.m. And sunrise, 4:46, 14 minutes to 5. It's getting later every day. It's all downhill to Christmas now. Yesterday, the summer solstice has passed.
The team at Manx Glass and Glazing are available for email inquiries. Contact them on enquiries@manxglass.com.
Need a new TV? Waltons offer a great selection from the latest Samsung QLED TVs to LG OLEDs. New models arriving this month. To see if we can deliver, visit waltons.im or call 611 711 for current operational details.
When you're going on holiday, don't forget your cat's holiday. At Pagode Cattery, we care for our guests just like our own cats. Phone 676 947 or see Pagode Cattery on Facebook.
Cowley Groves offer free post-lockdown property advice and assistance island-wide. With super competitive rates, high-quality video marketing, unrivaled social media presence and on-call 24-hour professional service. Call 625 888 today.
To help support the Man Cat Sanctuary, you can visit our website and donate to our food bank, or visit Bradley's gift shop. We rely entirely on the generosity of our supporters and worldwide visitors. Visit our website at mancat.com for more info.
The Mannin Line with Andy Wint, furnished by Magic Carpets.
Good afternoon, it's 6 minutes past 1 and this is Manx Radio live from the Isle of Man. The Mannin Line in session through till 1 today, and the Health and Social Care Minister, David Ashford, MHK, is with us live. If you want to get in touch, you can text on 166 177, email studio@manxradio.com, or you can call 66 13 68. Well, who would have thought, in the forbidding days we've had in the past 3 months, we'd be where we are today. And I'm delighted to say David Ashford, MHK, is live in the studio. It's the first time we've been at the end of phones for something like 3 months. Are we really clear now?
Well, you know me, Andy, I'm very, very cautious. I think at the moment what we can say is there's low to zero community transmission, so we're in a very, very good place. But that doesn't mean we should be complacent. This is a virus. It can always come back.
We've had no new cases now for how long?
It's 32 or 33 days. I'm beginning to lose track myself now.
What are the probabilities of there being a case? And if there were a case, how would it have happened?
I think the only probability now for a case to emerge is someone coming into the island via the borders. But obviously there's isolation criteria, so we would expect them to be isolating. But obviously if they were identified while they were isolating, that would still be a case on the Isle of Man. But there shouldn't be any community cases currently.
David dropped us a note. He said, a question for Mr. Ashford. I'm a Manx resident in Spain wanting to return to the Isle of Man. What are the UK regulations for me when I enter a UK border? Will I be able to travel through the border without self-isolating in the UK while I wait for my travel documents from the Isle of Man government?
But my understanding is if someone's coming abroad into the UK, if they're a Manx citizen, then they do have to self-isolate within the UK for the period that they're there. There's nothing to prevent them travelling through the UK to get to the port to be able to come back. But if they're staying within the UK for a number of days, they do need to self-isolate during that time.
OK. Stephen, a question. In the UK, there are certain exemptions in place for people not needing to self-isolate for 14 days. One of them is being a seafarer. My question is, would a seafarer that's returning to the Isle of Man from being at sea be exempt like the UK rules, or are they required to self-isolate on the Isle of Man?
Currently, they are required to self-isolate as well. The reason being that the 14 days is one of the big protections that we've had, because it's the top-end incubation period of the virus, and for many cases, it's also the life cycle of the virus as well. So it is a big protection for us. So unlike the UK, we are not willing to waive the 14 days.
OK. A question that said, after 3 months of being locked down, is the Minister concerned about the mixture of other viruses that will be around? We're talking about children going back to school now, and the mixture of measles, mumps, rubella, chickenpox and things like that. The normal kind of run-of-the-mill viruses that we've had. Do you expect those to reappear?
I mean, obviously, there's always a concern about that. Viruses do circulate in the community constantly throughout the year. We haven't seen any evidence of any increase in other forms of viruses as yet, but you would expect other viruses to circulate as normal.
OK. Can you give us any update on the situation regarding Abbotswood?
So all I can say in relation to Abbotswood is the DHSC, we have had to suspend our inquiries because Expol, who we brought in, said that their investigation said it was a matter that reached the threshold to be referred to the police. It has now been referred to the police, and therefore its police investigation's ongoing, so I can't comment on an ongoing police investigation.
And everybody who was reallocated, they're still elsewhere, are they?
So most people now have actually been moved out of DHSC facilities and have been relocated to other homes. The figure I have in front of me at the moment says there's 7 people still from Abbotswood in DHSC facilities, but I believe that every single one of them has now been allocated a place at another care home.
The situation as it is now, just about everybody is back where they should be. What's the situation with dentists and opticians?
So in relation to opticians, we're working with them to get their standard operating procedure in place so that they can reopen as soon as possible. There's been lots of discussions going on with the opticians between my chief executive and DHSC and their representatives, and I'm hopeful that we should be able to have announcements around that either the end of this week or the start of next. In relation to dentists, they are open, reopen, but only for certain procedures. They're not doing the routine at the moment. Their standard operating procedure and procedures are due, I believe, to be reviewed at the end of this week. And again, there'll be able to be further announcements end of this week, start of next.
So when do you think dentists and opticians could reopen?
So, well, dentists are reopen, I should point out, but only for certain procedures. In terms of a restoration to normal, it will have to be a phased approach.
Okay, a question in from Mike, and it said, how long will it take to take up the slack of missed appointments and deferred courses of treatment and screening programs?
It will depend upon what someone is waiting for, because obviously the waiting lists are different depending on what procedure. But I've been perfectly honest and blunt about this the whole way along. COVID is going to have quite a big impact on our waiting lists, and in some areas we may potentially have to look at what we can do waiting list initiative-wise to bring them down. But the big problem we face is other countries are in the same position. So there's not going to be UK consultants we can just call on to bring our lists down, because the UK is in a similar position and they'll be dealing with their own lists.
So this could take months.
It could be a long time. It could even take over a year to bring the lists back in line.
Before coronavirus hit, the Health and Social Care Department was afflicted by shortages in various places, shortages of skill and shortages of personnel. Is that still the case?
It is still the case. It's certainly not changed over the COVID period. We have been continuing with recruitment over the COVID period, and we did manage to make some more appointments. But yes, we still do have shortages of staff. It's the same within the UK and most of Europe as well. There are certain specialities where it's very, very hard to get the staff in place.
A question in now, this is G, who said, what's to prevent a visiting essential worker who can't go to a UK pub going to a pub while they're here and spreading the virus?
Well, the fact is they are issued a direction notice upon entering the island. So key workers aren't allowed to circulate in the community. If they do so, it's a criminal offence and they will be arrested and charged.
Because there are all sorts of Manx whispers about key workers distributing here, there and everywhere. So that is a criminal offence. It
is a criminal offence. They have to, when they come in, they are allowed to their place of work, but they have to travel between their residence, be it a hotel, and their place of work, and they must self-isolate outside of work for 14 days. If a key worker has obviously been in the island longer than 14 days, then they are free to move around.
David Ashford, MHK, Minister for Health and Social Care, is with us live on the Mannin Line on Manx Radio. We're also streaming on YouTube as well. And a note in from Chris said, could you ask the Minister what controls are in place to stop using compassionate travel permission to go on foreign holidays?
Well, it wouldn't meet the criteria for compassionate travel for a start. It is a very strict criteria, and I know that the team in the Cabinet Office do background checks to check that the information they're being given is accurate.
So nobody can fib.
People could probably try and game the system, but they stand a very high likelihood of getting caught. Someone would not meet the compassionate travel purposes for just, say, going off Ireland for 2 weeks to Spain.
Just to reiterate this question, Ian, given the optimistic talk on the virus by the government, when will surgery appointments be back to normal?
Right, elective surgery, we are looking to get up and running within the next week or so to start getting some elective surgery. One of the theatres we converted to give us expanded intensive care capacity, so that's having to be converted back. But again, it's one of those we should be able to give an update on the end of this week. But again, I do have to emphasise, when the person says back to normal, there are going to be extended waiting lists because of the COVID-19 situation.
Okay, let's go to Ken, who's on the line. You're on the line with David Ashford. Ken.
Good afternoon, gentlemen. Although not a big believer in the antibody tests we bought, because I couldn't see the point in them, how many have we actually used? Because the millions sitting in warehouses in the UK.
Right, well, what we're doing, Ken, is we're calling, because they have life expectancy on them, the antibody tests. So we've bought 10,000. We're doing the first 5,000, which we've called off between now and the end of next month. We've currently used 2,000 of those 5,000, was the update I had this morning.
And are there any results out of those two?
There are, but we're not going to publish results intermittently because they're not like swab tests. What we're doing with antibody testing is we're basically doing a population study. So it's to see how widespread the virus went throughout the community. So we'll be doing an interim report, which will be a public report after we've completed the first 5,000, and then we'll be doing a final population study report, again a public report, once we've finished the 10,000.
Okay, thank you for that.
What are you hoping to gain from that report, from the population study?
So basically it's to see how the virus has spread across the community. So we're looking at random samples of people who'd called 111 and have proven negative. We've been looking obviously at the positive cases to see if they were in the end positive cases, whether they've got the antibodies there. And it's to see across different age groups if there was a spread of the virus that we didn't know about.
Is the population, you've often talked about the clinical advice, was this outside clinical advice, or were they members of the Isle of Man civil service and clinical staff that were giving that clinical advice?
So clinical advice is delivered by our clinical leadership team. So the clinical leadership team is chaired by the Director of Public Health. It has GP representatives on. It has the clinical psychologist. I apologise because I'm bound to miss someone here. It's also got obviously our medical director. It's got all of the clinical consultant leads on it as well. And there is also community represented on there as well, and they come up with the clinical advice as a group that then feeds forward to council and ministers.
Could you, because some people have heard about this but don't know how it works, what are the rules for returnees? And who vets the self-catering accommodation and polices self-isolation?
So in terms of rules for returnees, there's various grounds on which they can come in now. There's the compassionate, obviously. It's a resident who hasn't left after the borders closed, who's trying to get back to the Isle of Man. There's obviously people with patient transfer as well who we sent in. The rules have changed in the last couple of weeks where people can self-isolate at home now, even if there's other members of the household, but it means the whole household has to self-isolate. It is up to now being policed by the police themselves, who have actually made visits and calls. The calls will be continuing going forward. Government will be continuing to make calls to those self-isolating to ensure that they comply. And as I say, it's a criminal offence for them not to.
A question in, this is Chris Kay, who said, what stage will GP surgeries get back to normal and you can physically see your GP?
So we are looking at that for people to go in. But one of the things I want to state as well is we do want to keep some of what we've got now. So the telephone and video triage in many cases has worked very well. So we will be keeping some of that in place. That's part of the Sir Jonathan Michael review on the transformation of healthcare services anyway. But in terms of people turning up to the surgeries where required, that should be in place again in the next few weeks, we're hoping. But we have to speak to the GPs and engage with them on that. And one of the things I would say, and I need to stress, is over the COVID-19 period, if someone does really need to be seen by the GP, they were still being seen. It wasn't a case of the GPs didn't see anyone. If the GP felt the person needed to come in for an actual physical examination, that was still happening.
Interesting that some of the behaviours and some of the things you've had to adapt to during COVID-19 may be adopted in future behaviour.
They will indeed. I mean, I think I stated at one of the press conferences that there are some good things that will come out of COVID-19. Certainly from a health perspective, there are things we want to hold on to. So the 111 helpline is something we want to keep. We also, the video conferencing we've put in place with consultants in the UK, that's something we'd want to keep. A lot of things that we were due to deliver anyway, as the Sir Jonathan Michael Healthcare Transformation Review, we've been able to do during the COVID-19 period.
Plenty of notes coming in. Text 166 177 or email studio@manxradio.com or call the Minister on 66 13 68. Please thank the Minister. This is Gary in Crosby. Thank the Minister for all his and his team's hard work during the pandemic. Ask if he's going to stand for Chief Minister. Well, I don't think you can stand for Chief Minister, can you?
Well, I haven't even decided if I'm standing for re-election next year, Andy, so let's take one step at a time. But
you don't know whether you're going to stand?
I'm a bit of a strange politician. I always decide about 6 months before an election. I was the same when I was on Douglas Council. I always decide about six months before whether I'll stand again.
Hello, Gary. You're live with the Health and Social Care Minister. Alistair, hello.
Oh, hello. afternoon, Minister, as well. There's a couple of points I just would like David to try and answer if he can at all, please. The first one is, what are the current rules for leaving the island for a resident? And the second question is this not an opportunity which is long overdue for people, before we open our borders, could we not consider now passport identification for people coming to the island for the future?
Couple of points there. Firstly, in terms of residents leaving the island, there is no criteria. Anyone is free to leave the island. There's no restriction on that. But obviously, if they want to return into the island after having left, they've got to meet one of the criteria around the compassionate travel, as to why they've actually left the island in the first place. So there's no actual criteria in stopping someone leaving the island. They just have to meet the criteria to be able to get back in again. In terms of passport, I know this is something that has been looked at about ID. It can't be pure passport control, because in that case we would actually be in breach of the common travel area, is my understanding. So if we went for full passport control, we would no longer be able to remain a member of the common travel area. So there, obviously at airports you have to produce photo ID, and that could be something that I know in the past has been looked at and discussed and may well be looked at again.
Right, well, thank you very much for that. But if I just may say so, it would appear as though the UK is leaving the European Union in December, or if not before. And if that's the case, will this common travel agreement still apply? I mean, how strict is this common travel agreement?
Yeah, sorry, I should have been clear. The common travel agreement is us, the UK, the Republic of Ireland, Northern Ireland and the Channel Islands. It's nothing to do with the European Union travel area. It's a common travel area between ourselves, and there is strict protocols around what we have for free movement of people within that common travel area. So it is quite strict, the criteria we have to meet.
Okay, thank you very much.
A question in from Mark to David Ashford. Do you have a timeline for when cinemas, theatres and other concert venues will be open for normal operation?
Well, there is nothing to stop them now, Andy. The restriction has been removed. But obviously it's up to the individual venues. One of the things is, because of how well the Manx public have done in tackling this virus, we've been able to move a lot swifter than I think any of us were expecting, certainly swifter than I was expecting as Minister for Health and Social Care. So announcements have been made very, very quickly. So a lot of places and a lot of industries have been caught off guard. So it is taking time for the cinemas, for the concert halls and so on to actually get in place, get the staff in place and bookings in place even to be able to reopen.
In those grim, dark days, people like yourselves, people like the Treasury Minister, were looking over the precipice. What's the key to our success? How have we got where we are now?
I think one of the things that's helped is clear and concise communication with the Manx public, is getting the message out there. There was no soft soaping it. There was no trying to play it down. Myself and the Chief Minister tried to be brutally honest with the Manx public. And it was the way the public reacted that has got us where we are. We asked everyone, and you can't underestimate this, we asked everyone to pause their lives, basically, to turn around and say, the way you've been living your life, stop it for now.
Were you aware,
to help our community?
Were you aware when you looked at that piece of paper, when the advice came within Comyn or the Chief Minister to say, look, this is what you've got to say to the Manx people, were you aware of that, the step they had to take?
We knew early on, we had been planning before we even had cases what steps we'd need to take and potentially when. I know looking back now it seems an age ago, but obviously we saw what was happening in Italy. We saw it was coming from across the world and we had time to plan. We didn't want to shut things down too early because we recognised such a change and fundamental effect on people's lives. We wanted to keep as brief as possible, but there was always a plan in the background of the stages where we needed to do things, and particularly when the first case was identified on Ireland, and then secondly when we had the first case where we didn't know where it had come from, where it was clear community transmission.
26 minutes past 12 midday. Health and Social Care Minister David Ashford is with us through to 1. And if you want to get in touch, text 166 177, email studio@manxradio.com, or you can call 66 13 68.
The Q Plus showroom and trade counter are both now fully open, with a fabulous range of bathrooms and all your plumbing supplies. Social distancing measures are in place for your well-being, or you can call the friendly expert Q Plus team on 673 131. And for opening times and all the latest information, visit Q Plus on Facebook.
qplus.co.im. Calling all retailers. With an all-island reach up to 6 days a week, you should be using Isle of Man Post Office as your local delivery partner. We've adapted to offer local businesses a new cost-effective local delivery service, no matter the size of your offering. With us, you won't need to worry about your insurance, reliability or safety of your products. To discuss your requirements and bespoke pricing, call 698 444 today or email sales@iompost.com. Isle of Man Post Office, your trusted business partner.
Help support the island's economy by shopping locally. Social distancing is no longer required. Please keep it that way by being vigilant and maintaining hand hygiene. For more information, visit gov.im/coronavirus.
Hello. Today we're visiting rossgower.com to see what they offer over the alternatives. Can I get an instant car insurance quote online? Yes. Tick. Can I buy my insurance online straight away? Yes. Tick. Do I have to wait for my documents? No, they're instantly emailed to me. Tick. Am I immediately covered to drive in the UK and Europe at no extra cost for up to 30 days? That's a tick. Can I pay monthly? Yes, big tick. So there you go, covered completely in just a tick. Rossgower Group Limited is licensed in Guernsey by the Guernsey Financial Services Commission, subject to standard underwriting.
Milan Vets would like to reassure you that we're still open for emergencies and sick animals during this time. We're starting to do routine procedures, but these must be risk assessed by a vet and booked in on a case-by-case basis. For prescription and food order requests and non-urgent appointment enquiries, email admin@milanvets.co.uk. For small animals, call 674 076, and for large animals and equine, call 674 532. For opening times and more information, visit our Facebook page, Milan Veterinary Practice.
Well, Jeffrey, your new conservatory solid roof looks great. It's still nice and light with the roof windows.
Yes, we love it.
They seem to be all the rage.
I've heard some horror stories, though.
Fox got in with the chickens again.
No. I hear some replacement roofs are too heavy for the glazed walls.
Surely you went to Spectrum Windows. They work high spec and to building regs.
Of course we did. We wouldn't go anywhere else.
Transform your conservatory with a solid roof from Spectrum Windows. Visit the showroom, Derby Road, Ramsey, or call 817777.
Going back in time on the sounds of the nation, it's the Caroline Flashback.
Later in the day, the town would be invaded by about 5,000 mods and rockers.
You're listening to Carnaby Street.
President Kennedy died at 1 p.m. Central Standard Time.
Chris Williams.
This is the medium wave service of Manx Radio, the first ever station to be authorised to broadcast in the medium wave band with a local commercial service for the people of the Isle of Man.
Saturday mornings, 8:30.
The Mannin Line with Andy Wint. Furnished by Magic Carpets.
And the Health and Social Care Minister, David Ashford, is live. I was looking at today's Jersey Evening Post, and Jersey's borders could be open within the first 2 weeks of July. The Chief Minister in Jersey, John Lafondre, has confirmed that the schedule of essential lifeline flights between Jersey, Southampton and Gatwick have been extended till the 19th of July. But the Senator said that he expected airlines to be operating commercial flights before that point as well. They can fly to France as well. What's the state at Ronaldsway?
So currently, Andy, I'm aware of the changes that Jersey are potentially proposing. Obviously, there'll still be testing going into Jersey. We don't use the same criteria as Jersey. They're doing double or 3 swabs. And unless someone proves positive, they don't have to isolate. We don't believe that's the right thing to do at the moment, because we know in the early days of the virus, even during incubation, someone could actually be swab tested and test negative, but then go on to actually prove positive. So we haven't gone down that route. We're sticking to the strict 14 days. They're expanding their flights, but at the moment there's still that choice in Jersey between testing or isolation. It's not just a free-for-all.
That's so the Isle of Man wouldn't be following that model.
We won't be following that model in terms of the testing at the moment. Obviously, if the risk profile in the UK drops on near neighbour, and obviously we've got to remember we're right by the northwest of England, which is still struggling in many respects to control the virus, we'll make decisions around that. And there is due to be a Borders roadmap published later this week, I hope, where the public will be able to see the various different stages in our Stay Safe document as to how we plan to slowly but surely release the borders over time.
What about flights to Northern Ireland and the Republic?
So obviously we've got to look at this from a commercial point of view for the airlines. At the moment, with border restrictions and limited passenger numbers, it's around whether or not it's commercially viable for the airlines to do so. If the airlines came forward with proposals to do so, there'd be nothing to stop them. But I think from a commercial airline point of view, there perhaps isn't that commerciality yet for them to be willing to reintroduce flights direct to the Republic of Ireland.
And obviously there are commercial imperatives within the Isle of Man. We're a small jurisdiction. We've got 1.6 billion in reserves, not all of it that liquid. And obviously we need to get back to work. So how do you square the circle of what's going to be commercially beneficial to the Isle of Man and what affects the public health? Which comes first?
Well, it's a balancing act, to be perfectly frank. I mean, obviously, from my role as Minister of Health and Social Care, obviously the overriding imperative for me is the health of the nation. But we do recognise as a balancing act. We've recognised that the whole way along, and that is why we've done things stage by stage by stage, and we've got now to the point where we've been able to open an awful lot of the internal economy. It's the external-facing economy, such as tourism, that is currently obviously still in a serious situation because they can't operate.
And who'll make the decision? Which information will you look to kind of break that logjam? That'll be UK information.
So in terms of the borders, yes, we'd be looking at what's happening around us because that is the biggest impact and the biggest risk for a reimportation of the virus into the island. So we would be looking at what the levels of infection across the population is in the UK, and it'll make more sense when people see the roadmap hopefully being published later this week, and they'll be able to see the different criteria that government has put for the various different stages of border relaxation.
What's a disinfectant tunnel? Somebody's talking about disinfectant tunnels used in certain areas being a feature at the airport in the future.
If I remember rightly, they're the sort of polytunnels. If I'm thinking, I might be thinking completely the wrong thing, but I'm thinking of the ones that they use that are polytunnels that spray disinfectant down. That wouldn't necessarily wouldn't necessarily get rid of the virus, because if someone's carrying the virus in their body, they only have to step out of that disinfectant tunnel at the end, wipe their nose, wipe their eyes, put it down on the surface outside. So I'm not quite sure if it's the disinfectant tunnels I'm thinking of, that they'll actually have the correct mitigation.
A question in from Steve. Could you ask Mr. Ashford what support and help are being given to the